Hey guys, I got your responses to what you think that we need to review. It looks like sports nutrition is something that most people are like, yeah, I don't remember that one too good. So we will be covering that one in the next review. So let's go over today's topics and then I'll kind of explain the rules. Okay, so we have in this PowerPoint legal terms. That's been a minute. We have careers, anatomy, infections, conditions. And here's the big board. Okay, so I tried this in intro. It seemed to me like it worked. And I get that you can cheat this process, but you're cheating yourself when you do it because this test is hard. So I'm hoping you stick with it in a way that is meaningful to you. But I will tell you how to get full points. So you will get a grid like this in the assignment. And you have to fill in, I want you to write your answer. Okay. And if you don't get it right, I want you to kind of cross that answer out and put the right one. You have to have the right one there or you don't get the points. Okay, so if we were to add this all up, I think the board is worth like 375 in the end if you got everything right. So your job is to score it. So I'm going to make you take off points if you get it wrong. And getting it wrong means if you say, I don't know, okay, that equals you don't know. So that means you take it off. You should know it at this point. Some of it's old. So I would get that, like, if you missed all the legal terms, I'd be like, yeah, it's been a minute. So that's fine. But practice. So you need to fill in every square. And then I say, give me your score after this part. So it's going to be 375 or less. And in factors of 5, if you're a cheater, do it well. I've had some real dummies with their, oh, this is 72. I had 72. How? How did you have 72? You don't get half points? I don't know. Just, if you're going to cheat, just think about it for a minute, okay? Because I will take points. So correct answers in here, the score after the board. Then you're going to say, I am wagering this much for the big points question. Then you need to write the answer to the big points question. Then you need to write your total score. That's how you get all the points. If you're missing any of those, you're going to lose some points. So just do it right. Okay, I'm going to just go like this and then like this. And then we're just going to go up and down these different ones, okay? So we're going to go 25. Not telling an athlete that they may get hurt. Not telling an athlete they may get hurt. Some of these sound like when you see the actual terms, you're like, oh, okay. Beep, boop, beep, boop, beep, boop, beep. Failure to warn. So if you got that one wrong, cross out what you wrote, and you're going to put a little negative 25 down at the bottom. We're just going to add and subtract and put failure to warn. If you don't have failure to warn in there, whoopsie. Okay, 20 for careers. This person treats the psychological factors of athletic participation. Easy. I feel like everyone should have got that. Okay, then anatomy for 15. Name, structure, eye. Orient yourself with this, okay? So anterior view, posterior view. Where is the fibula? Okay, so if we have fibulas here, that means that's the lateral side, right? So let's find eye. Eye is here. So what's the name for the pillow of the knee? And it's the medial one. Okay. Then we go infection for 10. If you need to pause if I go too fast, because I'm not sure how fast to take this. It might be easier for you to go pause, see if you got it, then click. Okay, so lesion defined by ring-like eruptions. This is an infection. Ring-like. Ringworm. It's ringworm. Okay, conditions for 5. Profuse sweating. Skin is pale or gray. Heat exhaustion. So if you pay attention here, I bet there's going to be another question like this. So if we go in order from least dangerous to most dangerous, it's going to go first, you're dehydrated. Like 80% of Americans are dehydrated at any one moment. So dehydration, and then it will go to muscle cramps. Then this one, heat exhaustion, and then finally heat stroke. That's the worst one. Okay, then we're going to go here. Legal terms. This term means you have a legal responsibility to act in a reasonable way. Liability. Okay, pause when you need to. I'm just going to blast through a bunch of these. Okay, careers for 10. Educates and trains athletes in proper conditioning practices. That is a certified strength and conditioning coach, or you'll see it as CSCS, and you can abbreviate it like that. Stands for Certified Strength and Conditioning Specialist. Okay, then infection for 20. This is a bacterial infection that has pustules that become crusted and rupture. I talked to you about this when Bountiful had it one year. Hey, Roadhouse, what's this? I'm like, oh my gosh, get out of my room. Impetigo. Bacteria crusted pustules. Yuck. Okay, let's go. We're going to go down the 15s. Okay, legal term, being told of all procedures and risks. So you'll have to do this before like a surgery. Informed consent, and also before you participate in sports. Okay, careers. Hands-on manipulation of soft tissue of the body. Maybe work on a cruise ship if it doesn't have all the infections. Massage therapist. Okay, infection for 15. This is viral, so kind of think about what was virus, what was bacterial, what was fungal when we were talking about infections. That's been a long time ago. Probably before Christmas. It's been a long time. And that feels like 20 years ago. Viral infection is, and it's small, fleshy, rough bumps. Viral. Warts. Gotta freeze those guys off. Okay, conditions for 15. This is an imbalance of sugar or insulin. Sugar, insulin. Diabetes. So basically it's a bad sugar reaction. So some people can be hypoglycemic or they can be hyperglycemic. Either way, there are problems with the way sugar is being taken care of in the body. Okay, let's go with 5s. This person in their career assesses the nutritional needs of athletes. It's the registered dietitian. So the one I worked with would be so mad that I put a C here. She likes it with a T. Dietitian. Okay, I don't want to stick with 5s. I'm just going to go all over. Anatomy. Yes, this rotator cuff. Let's go. So name structure C. This is structure C. It's right below this structure. That's your big hint. And it is below it, so infraspinatus. Infraspinatus gives you external rotation. Let's go 25. Anatomy. Structure B. This one. So this is a muscle. One of the rotator cuff above the spine. Supraspinatus. So this is abduction. Abduction. Okay. Legal terms for 20. Treatment that is reasonable and prudent. Reasonable and prudent. Standard of care. Anatomy for 10. We're going to go structure H. Okay, so here's the posterior view. There we have it. Structure H. This is the anterior view. Okay, good plant and twist would knock that little pup out. ACL. You can abbreviate ACL, anterior cruciate. All right, let's go back to 25s. This is when the sweating mechanism fails. If you were paying attention earlier, this is the worst one. Worst one. Heat stroke. Okay, let's go anatomy for 5. Let's go to structure D right here. Boop. Boop. Orient yourself. It's the same knee. What's this little bone? Oh yeah, that's called a fibula. So we know that's the lateral side. Tibia's medial, right? Okay, so structure D sits here, or when we flip it around, here, on the lateral side. This is the LCL. Let's go infection for 25. This does not respond well to antibiotic therapy, suggesting that this is a bacteria, which it is. It's MRSA, which is essentially staph infection. Staphylococcus. Okay, let's go 10. We'll get one of the 10s. This is a condition in which you get constriction of the air passages. Asthma. Okay, legal terms for 10. Negligence while providing care. Malpractice. Okay, and remember, to prove negligence, you have to go to BIP. So remember the the sponge. Let's the sponge counter. You have to have a duty of care. There's a breach of the duty. Okay, their injury occurred, and the proximate cause was freaking you. You did it, or you should have done it. Okay, careers for 25. Studies the effects of exercise on the body. These people I hear are super dope. Like the best kind of the people. Best. And I might have done this in a former life. Ready? Exercise physiologist. Okay, last two. Infection for 5. Fungal infection. Red, scaly, itchy between toe. Ew. I just picture like big Shrek feet with like ugh. Athlete's foot. A lot of people get it. Wear shower shoes. Okay, and finally for the big board facts, 20. This can be caused by head trauma or epilepsy. If you guys think you get 100, if you were like, oh, I got 375, here it is. Make sure it adds up one way or the other. Drive me nuts. Seizures. Okay, so you should have a total right now. So on your assignment, you should have a filled out board. Now you're going to have, you're going to add up your points, add and subtract your points, get to your final tally. Might be negative. If it is, that's a signal that you need to study hard. Lots of Quizlets out there. The final quiz is there. And if you have time today, which I meant this to be kind of short, get on that final Quizlet and just boing, 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 or maybe even hit whatever unit you're like scared about. Hit that Quizlet pretty hard. Okay, so right now, go ahead and wager. Here's the topic. The big points question. So if you have, I'm trying to think. I'm going to even let you. So if you went negative, like if you actually went negative, I'm going to say you can bet whatever it is to break even. Let's see if you can get it if you break even. Okay, so if you got like negative 50, let's go. Oh, big points question. You can go 50, right? Yeah, that'd be good. Let's do that. We're going to go 50 points and you can get back to 0 at least, because then you feel like a hero, I guess. Big points question. Here it is. You have 30 seconds. What are the 4 requirements Shoot. What are the 4 requirements necessary to prove negligence? I didn't even remember this is the final question. I gave it to you if you listened. If you listened, it was in here. I shouldn't have said that. 7, 6, 5, 4, 3, 2, 1. That was annoying, I bet. And here is the answer. Dub bip. Is that it? Oh my gosh, I'm gonna cry if that's the wrong way to spell that. I fixed it because I'm gonna be honest with you. This is one of the ones from the state, this PowerPoint, and they spelled this with E breach. Remember what I said about the state people and writing worksheets? Ooh. Okay. Study. Guys, I don't know how to... I know it's unmotivating to be home and study. It's unmotivating to work out in a home gym. But guess what? That's where we're at. It's a college class. And I've given you every last bit of information. Now it's on you. I need you to just come through next week. So get that Quizlet down. And we'll get to the final test and call this the year.